Interesting session on iCGM performance and accuracy standards, a topic of growing relevance in diabetes care. I now invite our esteemed speaker, Dr. Kenneth Lee, Regional Medical Affairs Director, ABET Diabetes Care, and consulting projects with WHO, Johns Hopkins, and Harvard School of Public Health. Over to you, sir.
Thank you. Thanks for the warm invitation and introduction. Good evening, everybody. My name is Kenneth. I'm based in Singapore. I lead the Asia Pacific Medical Affairs Organization. Really happy to have everybody here today. For the next 15 minutes, before I go into the launch of the new product proper, I think I wanted to take some time to thank everybody, for increasing the awareness and also, representing your patients and educating your patients for diabetes. This news came out on the 9th of July, just a couple of days ago when I was in Mumbai. And I think it's a great testament of all the collaborations that's ongoing to make awareness being such a huge thing with regards to diabetes and also diabetes monitoring and treatment. So I want to thank each and every HCP in the audience for being here today, but more importantly, going back to your practice and doing so much for your patients on a day-to-day basis. On behalf of ABET Diabetes Care and the CGM community, thank you. I wanted to start today to talk about, and raise a question. Are all CGM systems made equal? Very easy answer is basically no. I wanted to give an update on basically iCGM accuracy and performance standards before I jump and introduce the Freestyle Libre 2 Plus sensor, which is available as of today to HCPs as well as patients living with diabetes in India. But before I go into that, I want to start off with describing a premise that I feel very strongly stands in the world today. Globally, diabetes is an epidemic requiring effective glucose monitoring. I think everybody would agree with that. At the same time, there is no effective tool historically prior to 2000 with regards to using BGM or A1C for glucose monitoring. And then with the evolution of the era, continuous glucose monitoring showing that it improves glycemic control and reduces hypoglycemia risk compared to self-monitoring of blood glucose came onto the horizon, and many people are using CGM today. At the end of the day, iCGM standards, for those who are either familiar or not familiar with the standards, essentially is for the safety of your patients. CGMs, very well-known, established, reliable players in care, are available in the market, very much spoiled for choice. Unfortunately, there are also other new players. Those spoiled for choice, these new players have issues, and we are concerned as a company, as with other iCGM players in the market, with regards to the protection of the category and the reliability of such iCGM for the safety of your patients. Very quickly, I want to go through the iCGM overview. I think most of you know about CE marking. However, CE marking only focuses primarily on the general safety of a particular product. CE marking was never intended to proactively identify gaps in specifically the performance criteria applied to a particular product. Hence, with CE marking, which is available with many CGMs in the market, what we think is CE marking plus other CGM-specific performance standards are definitely necessary for a robust approval process. Unfortunately for us, globally across the globe, other than the iCGM criteria currently present from the FDA, with the US FDA being the most robust and strict regulatory authorities, there aren't any other criteria available. Unlike your pacemakers, your BGMs, and your insulin pumps, where there are existing standards. So in 2018, a bit of history, FDA introduces a new category. And they shifted this particular category for CGM monitors in the market, CGM sensors in the market, to rename them integrated continuous glucose monitoring so that they can integrate with other technologies, specifically insulin pumps. With that category created, it was needed to have some special control performance requirements. I've listed all of it here, and I will not go through each and every one of them. It's very wordy. But what's important to understand is within these words, there is a set of 11 criteria that a CGM, for the safety of your patients and the availability, not just of the CGM in the market, but to be able to make treatment decisions, these 11 criteria needs to be satisfied. All 11 of them. Not 1, not 5, not 6, all 11. So what do these special controls or these mathematical cutoffs actually mean? The first 6, 7 criteria actually refers to the interval and overall accuracy of the particular sensor. The next 2 criteria, H and I, talks about the accuracy of individual measurements. The other 2 talks about the accuracy of trend arrows. And then we have one that addresses choroid accuracy, and lastly, the wearing stability of the particular sensor. So well and good. If you have a sensor that covers good overall accuracy, has accuracy of the individual measurements across the glucose range, has accuracy with regards to trend arrows, suitable to be used in pediatrics with accuracy, and also of reasonable wearing stability that fulfills the iCGM criteria, then that CGM will be called an iCGM Professional Standards Approved CGM. Here, I just want to show a particular table that shows the criteria in greater detail, but essentially I'm proud to say that the Freestyle Libre 2 Plus fulfills all, not 1, not 5, not 6, but all criteria in the iCGM Professional Standards special controls. I will leave you with some interesting standard publication readings up to 2025 today. I'll not go through each and every of them. But I think the most important paper was Klonov describing the history of iCGM specifically from a US perspective, moving away from a lot of the facts that a lot of these devices require finger pricking or adjunctive use versus accuracy studies having limitations which are often not published in peer-reviewed journals, to the point where we need to acknowledge that a lot of the devices cannot be automatically perceived as having the same performance or quality standards than those iCGM devices. But what's more important is, although Klonov publishes in 2024, earlier on in 2020 and 2021, outside of the US, there started to be issues with some of these device accuracies, non-iCGM devices, and patient safety was compromised. In a region in Italy, for example, a poor accuracy at low as well as high glucose levels was reported with a particular CGM device which was unfortunately awarded in a tender, and it was so serious that clinicians then recommended users returning to fingerstick blood glucose monitoring to safely manage their diabetes. So that's of concern in Europe, and a group of European endocrinologists, Dr. Tade Bertolino is in the audience, but under the president of EASD, Chantal Matthews' leadership, provided a commentary published earlier on this year to look at how does Europe stand with regards to CGM criteria and CGM standards. The paper is a fascinating paper to read, but it essentially summarizes 7 further steps that one needs to consider over and above and in addition to the iCGM criteria, building on the need to consider a few things when you consider the CGM use from an accuracy study perspective and the CGM perspective on a day-to-day basis for the patients. Consider the wear sites, consider the wear period, consider the stable transmission of the particular CGM to the reading device. There shouldn't be any interfering substances that and one should be aware of the interfering substances for the device. There should be no extension of the wear period. So if a sensor is purported to be used for 14 days or 15 days, it should be used for that wear period. And under the receptor operating characteristic for the entire dynamic glucose range, the sensor should perform as it should perform across the range. Some aspects within this particular fascinating commentary covered things around consideration and due consideration for data privacy, cybersecurity, skin allergens, and full data disclosure. Later on in the year, a group of nurses on the UK side also provided a very nice and neat table considering all the CGM players in the particular market, UK, and grouped them according to non-adjunctive use and adjunctive use. The table is never exhaustive. I think as I speak now, probably more CGM sensors are added to the table. And my point here is all CGMs are different, and you need to make due considerations for the CGM of choice for your patient. You need to consider robust clinical data that demonstrates accuracy in the intended use population. Has the CGM been used showing clinical outcomes and experience amongst users across patient groups, either in randomized controlled trials or real-world studies, all in the T1, T2, adult, pediatric, and pregnant patients living with diabetes. So those are the due considerations. So my key takeaways for this particular session before I launch the Freestyle Libre 2 Plus product, which is of relevance to the iCGM performance standards that I talk about, is that CGMs do help more and more Indian patients living with diabetes better manage their diabetes. But when it comes to clinical outcomes and patient safety, please do not compromise the use of a particular CGM for your patient, because not all CGMs are created equal. Do consider US FDA requirements for iCGM, which has been and probably will be the most rigorous currently of any major regulatory body. Soon we'll see more of these coming out from Europe, and there are some endorsements as well coming from Asia Pacific. But the consensus proposal from European experts is just a beginning. As we consider more and more use of these innovative technologies, which are great for our patients 24/7, 14 days and soon 15 days, these iCGM standards will provide that solution for now, but I think for consideration of safety, you need to consider all aspects of the use of CGM. So what's new with Freestyle Libre 2 Plus? And I've promised to cover this within the next 5 to 6 minutes. We are in the history of evolution, and I thank everybody for being that endocrinologist, that diabetologist in this journey with all of us. I think most of us remember the use of urine dipstick and then subsequently blood glucose monitors in the monitoring of our diabetes patients. But more importantly, with the advent of technology and the continuous glucose monitor being a household name and standard of care, Freestyle Libre systems continue to be on the innovation journey with all of you. Across the world, worldwide, 7 million users are using Freestyle Libre systems. We acknowledge they are available in over 60 countries in both cash pay and reimbursed markets. And we work very hard to try and make it a better place in terms of access for these patients living with diabetes worldwide, as we discuss those with the local affiliates. From a plus sensor perspective, I encourage everybody to look at the 2025 publication, which identifies and articulates the Freestyle Libre 2 Plus sensor performance, which was a prospective multi-center study looking at both the Freestyle Libre 2 Plus and 3 Plus sensors, which was a modified sensor over and above an improvement of what you have yesterday. More than 149 adult subjects, pediatric subjects, were enrolled into the study, and the study had a protocol that looked across the entire dynamic glucose range from 40 to 500 milligrams per deciliter. If you recall the table that I showed, that there was an iCGM requirement for 87%, at least 87% of the proportion of the results of overall glucose readings to be within 20% or 20 milligrams per deciliter of the reference glucose reading. Over and above this, our adult and pediatric population has a 94+% proportion of glucose readings within this accuracy range. If you look at it in a much tighter interval of 15%, again with an iCGM requirement of 87%, both in the adult and pediatric population, we have 97 to 98% of the results way above that range, reflecting much accuracy within this tight range as referenced with the reference glucose range. With 8.2% MARD overall in adults, as well as 8.2% in peds, and strong low-end performance and unmatched wear performance and dependable clinical performance, as well as a reduced lag time that some patients and some clinicians may be aware or want to note, is with the previous Freestyle Libre that you have yesterday, it was probably about 2.4 minutes up to 6 minutes for adults, and 2.1 minutes up to 7 minutes for pediatric patients. Today, with the Freestyle Libre 2 Plus, you're looking at a 1.7 lag time in adults and a 0.9 minutes for peds, published nicely in the paper in 2025. For those of you who are interested in the consensus error grid, 99.9% of the readings fall within the consensus error grid zone A and B, which then reflects that there's no need for any there's no effect on any clinical action, and there's little or no effect on the clinical outcome. Across the entire wear period from day 1 to day 15, you have more than 90% of the readings within 20% or within 20 milligrams per deciliter of the reference glucose range. We are proud of this because we are the only iCGM sensor that maintains such high degree of accuracy out of 15 days. And at the same time, for those who are concerned with strong low-end performance, especially the level 1 and level 2 hypoglycemia, we have almost 99 to 100% in accuracy within that low glucose ranges as well, both in adult as well as the pediatric population. Those who are concerned about alarms, you have the alarms as of today with the Freestyle Libre 2 Plus. Those who have other sensors that maybe detect the glucose every 5 minutes or so. Our Freestyle Libre 2 Plus continues to provide glucose readings updated every minute. And we continue to be IBOA and MBPA free. So on the right are some pretty gory and I apologize, pretty scary dermatitis side effects of other sensors that have had adhesive issues because they contain IBOA and MBPA. We are proud to reiterate that the Freestyle Libre systems and the Freestyle Libre 2 Plus as well are free from IBOA and MBPA, which are common skin allergens in the adhesive and the sensors. Lastly, with regards to interfering substances, and that's why the 2 Plus has this indication with FDA, and it's of course of concern sometimes prior to the availability of the sensor was interfering substances, specifically vitamin C. So now up to 1,000 milligrams, or you have to take more than 1,000 milligrams per day before that will interfere with higher sensor readings than actual glucose, specifically with the Freestyle Libre 2 Plus sensor. So remove the concern about CGM interfering substances as well. So with that, the Freestyle Libre system, which we call the Freestyle Libre 2 system, continues to provide the continuous glucose sensor readings on a minute-by-minute basis, now real-time to your patients as well as for you as a HCP and even for the caregivers. The new sensor name remains as Freestyle Libre 2 Plus. We have increased the wear duration from 14 days to 15 days. The age range has come down, so now you can use it on label for 2 years old and above. For those who are interested in MARD, the accuracy improvement has dropped from 9.2% of MARD to 8.2%. It allows for integrated experiences with insulin pumps and smart insulin pens, and not to forget what I mentioned just now in terms of the better or reduced lag time or non-existent lag time. So I encourage you to try the upgrade. I encourage you to explore the Freestyle Libre 2 Plus sensor for your patients and for their caregivers as well. With that, I thank you, and I thank JPEF as well for the invitation and the launch of the Freestyle Libre 2 Plus sensor. Can we have the video, please?